Welcome back. March is Social Work Month, a time to appreciate the valuable work that social workers do. The month recognizes that there is a great need for youth mental health support. While some teens are receiving mental health services, 20% report not getting the therapy they need due to issues such as cost, fear of stigma, and lack of awareness. Budy Garcia-Whitfield, the Assistant VP for Behavioral Health and Wellness at Westchester Programs for JCCA, joins me to discuss this important issue. Budy, thank you so much for joining me.
Thank you for having us.
Now, can you tell me a little bit more about JCCA and their history?
Of course, JCCA has actually been around for over 200 years. We're one of the oldest organizations in New York, and we've expanded. We actually started off as an orphanage back in 1822. And we've expanded our programs into the city, into foster care, preventive, residential services, and we also started serving kids across the different counties in New York State. Our services have become robust throughout the years, where we've expanded our behavioral health and wellness division to encompass our very first Youth Act program in New York City.
Now, what types of services do social workers provide at JCCA?
So social workers, we're not a monolith. We actually provide so many different services, from case management to one-on-one interventions, preventive services, evidence-based treatment, trauma treatment, and support for youth and families.
Now, I think it's so great that you said that, social workers are not a monolith.
No.
And I think that March is like a wonderful month. As we all know, it's Social Work Month. To learn a little bit more about the work that they do, can you just explain, why this month is so significant in your opinion?
Yeah, so in my opinion, I've been a social worker for almost 19 years. And the work is historical, and it's important at the way it started. We started off by helping others, serving others in need. There's no coincidence that March is also Women's Month,
Right, yeah.
and so that we're also celebrating Social Work Appreciation Month because of the work that we do. We've grown in different capacities in our roles. Not only have we served children, youth, doing really community-based services, but we've expanded also into the for-profit sectors, because people have noticed that the social work division and the work that we do and our expansion can help in so many different sectors, in government, in for-profit organizations, not-for-profit, and even ground roots work, which is where we started.
Now, I definitely want to take a moment to highlight adolescents. A recent report from KFF shows that about 1 in 5 adolescents report symptoms of anxiety or depression.
Yeah.
What do you think is contributing to that crisis as somebody who, works in this field?
Yeah, so a lot has changed after the pandemic. Kids and parents and individuals were honed down into their home. Some people had to lose their jobs, others stayed working remotely, and kids were remote for a very long time. It gave a time and an opportunity for them to expand their curiosity on social media. Social media has really impacted how much a youth's mental health crisis is. Youth actually spend almost more than 2 hours a day scrolling online that has nothing to do with their schoolwork. It's increased their depression because they're comparing themselves, especially if we look at girls, we look at what societal norms are now. People are expanding themselves to kind of think of, can I be that? Am I that? But it also opened up a different door for bullying. It opened up people's opportunity to send messages through Snapchat, through different platforms, in order to make fun of other people, in order for people to compare themselves and prevent their burnout into someone else.
Now, what I think is so interesting about this, and it just comes to mind as soon as you say this, is that this has been such an issue for quite some time.
Yeah.
The internet and social media has been around for such a long time, and we see just as generations go by, so many teens and young people are affected by social media and the impact that it could have on your mental health.
Yeah.
As somebody who has worked in the industry for 19 years, what are some ways you may have seen this maybe evolve or become worse over time?
Yeah. So I've actually seen social media can be great, right? The new constructs of AI can be great to help you with finding information, getting information. You don't have to sit in the library for hours like I used to do back in the days and like pull out the card and get information. Everything is Googleable, if you will. However, if we look at, because there's so much rapid access to information, there's misinformation that is out there. One can think about how doctors tell you, do not Google the symptom because you're going to think the worst case scenario. And so that is happening. People are going online to pour out their hearts, they pour out their emotions, to question certain things and getting answers that are replied back to them that are not necessarily helpful. And what it's done is actually isolated us furthermore. If you walk down the streets right now, how many people are going to be on their phone?
Right, a lot of people.
If you go to a restaurant and you watch a parent with their child, how many parents are on their phone and the kids are on their phone?
Right, or their iPads.
Or their iPads.
Right, yeah.
Right. So people are no longer talking to each other. People are sitting with their devices and pouring into those devices and spending a lot of time. So if we think about that, the human interaction has declined. It's lessened because now we're interacting through media platforms. And because of that, people are really not able to be their altruistic self and having those conversations about what is really going on for me, what's coming up for me. And so could you imagine a teenager who's already trying to figure themselves out, identify who they are, where they are, how they fall in line with different things? This is coming up even more prevalent.
Now, we talked about youth, but I also want to talk about another demographic that could be struggling with mental health issues, and that is, women and girls, along with LGBTQ plus, people in that community. Can you talk a little bit more about why the need is a little bit more dire for these communities in regard to mental health?
Yeah, so we think about it. It's not only women and girls. Boys also are in need of mental health supports because they are more stigmatized if they seek support. In contrast, women and girls are actually more infused and they're more accepted if they are receiving some sort of help. The LGBTQIA population also falls in line with boys because they are struggling or working through or in identifying who they really are to really meet their societal norms, to really be seen and to be heard. And so some of that kind of tapers seeking the help and the support. And so what happens is because there are all these social constructs, it impacts their ability to navigate, to get services, but to really get the services that they need. The services that are out there are not really focused on the evidence-based models. And if you think about a lot of evidence-based models when it comes to treatment for youth, families, individuals, children, and different populations, they're really not culturally constructed. And so you find yourselves as a therapist, as a clinician, trying to pivot to really try to help whatever community you're serving.
Now, can you expand on that? Because I think that's actually really important. You said they're not culturally constructive.
No.
Can you, for those who are not aware, like what that actually means and how we see that play out when somebody is seeking help?
Yeah. So when we look at the evidence-based models that have been created, and they've been great models, and I'm trained in a lot of different models, they have not been created with thinking of different cultural and societal norms. And so often clinicians or social workers find themselves having to pivot and incorporate some cultural norms in order to help ameliorate some of their symptoms, but also to normalize some of the symptoms that are going on. If we think about diagnosing the DSM-5 and what that looks like, you would think that someone has all these problems, when in fact we have to take a step back and think about where is their cultural norm, where is their community of origin, and what can we do to tailor their needs in order to provide the right interventions for them. That's something that we do at JCCA with all the different programs and evidence-based models that we have. We actually have to construct it to the communities and the populations that we serve.
Now, that kind of leads to my next question because as somebody from the Bronx, from communities of color, sometimes mental health isn't always, I think we're getting better, but it's not always seen as something that needs to be addressed, especially for youth. Now, what are some tips you can share with parents who may have noticed or have been told by their children that they feel that they need therapy for some mental health issues, especially for those in low-income communities or communities of color?
So the first thing I'm going to say, not only as a clinician, but as a parent, it is not about you. What happens is parents often put themselves and think, if my child needs therapy, it's because of me. You have to remove yourself from the I and think of it from a different lens. If your child had diabetes, wouldn't you take them to the doctor? If your child broke their leg, injured themselves, etc., you would go get them the treatment that they need. It is the same way. It's not about you and what might come up, what's going on in your household or how you've parented them. That you got to kind of work through. You have to think about what can I do to support my child to also destigmatize and normalize getting the help for your mental health needs, just as you would if they had a sore, if they needed their annual shots or annual workup and checkup.
And what are some ways that parents can, be there for their child, but also we know with teens, sometimes they do need space. How do you navigate finding that healthy balance between being a present parent but not being overbearing?
It's hard. I'll tell you from two different perspectives. But all it takes is trial and error. That the best way to navigate it is trial and error, but communication. Sometimes we assert ourselves so much in a parent role, depending on the culture that you come with, right? You either seen and not heard. I'm the parent, you don't have a voice. But differentiating that and allowing them the opportunity to know that they are part of the familial component and that they can have a seat at the table, and there's conversations you could have. So trial and error is important. But what I will add is that when we've seen parents involved in a youth's treatment, we've seen tremendous strides. If we think about the different evidence-based models that we were talking about, one of the programs that I oversee is the MST Fit program. We have the trauma-focused cognitive behavioral piece. All of those components want the parents or the caregivers, if the parents are not involved, but a caregiver or an adult involved in order to see the treatment and the progression of treatment.
Now, with all that being said, this is such an important issue to really look at, especially in regard to teens. And I want to kind of highlight the organization again.
Yeah.
Why do you think the JCCA has lasted 200 years, and what makes it stand apart from other organizations like it?
Yeah. So JCCA has been around for 200 years, as I've said. And the reason why we stand apart is because we continue to evolve and grow with the future. We've noticed that there was a trend at this moment in pouring into youth behavioral health. A lot of people are struggling out there, and the organization has quickly adapted to that and shifted and actually expanded exponentially our behavioral health and wellness division. And not only seeing ourselves or pivoting ourselves just as a child welfare agency, but also seeing how much we can pour into the community. A lot of our services are community-based. We are in the Bronx, we are in Brooklyn, we are in the different counties, up in Westchester and different counties, in order to provide that healing and that support. And I think the agency is going to last another 200 years because we continue to progress with what the needs are.
Well, I want to thank you so much for joining us and having this conversation. I think it was just so important to talk about, mental health in general, but in regards to teens, especially in communities like the Bronx. So I want to thank you once again just for having this amazing conversation.
Thank you, and thank you for having us here.
To learn more about the many services the JCCA offers, please go to their website at www.jccany.org. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch a recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at BronxNet.org. You can catch a brand new episode of Open with Darren Jaime on Wednesday and with Rena Valentine on Friday. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.